Hi, I'm Liz, Dr. Liz, Doctor of Acupuncture and Oriental Medicine. We're going to talk today about TCM tidbits and why life becomes better living. I'm going to teach you guys a pressure point today on the pericardium channel, and it's called PC6 or Neiguan. And can you say Neiguan? It's translates in English to the inner pass, and we know it in traditional Chinese medicine as either PC6, Neiguan, pericardium 6, or the inner pass. And it is great for new moms, buddy up to the PC6, the inner pass. And it's actually good for so many things, whether you have nausea, chest pain, hiccups. This is a point that you can apply and use safely, including, yes, you pregnant moms. It is super safe for you to do this and go to your acupuncturist, but you can also apply the pressure point yourselves. So here's how it works. It is approximately right here, 2 inches above the transverse crease of your wrist. So right there on the inside. And you want to go in between the 2 tendons of the palmaris longus and the flexor carpi radialis. And that would be these 2 tendons here. So you can feel them on your wrist. So, right about there. Right in between those 2 tendons. Just feel them. And it's right in there. And if you press on that pressure point, it can help settle down your stomach from morning sickness. Booty up new mommies. And anybody who's suffering from chest pain, arrhythmias, AFib, it helps to improve the condition. Yes, it does. It's a little bit older than Pfizer, folks. It is. Some can argue 8,000 years old, certainly documentably over 3,000 years. Pericardium 6, the inner pass, PC6, also known in Pinyin or Chinese as Neiguan. And it also calms us down, helps us become less irritable, less angry, and less stressed out. So it does treat anxiety. It also regulates, as I mentioned, the irregular heart rate. So irregular heart rate often has a root cause of anxiety, stress, can trigger the heart to not function smoothly and cause an irregular heart rate at the root level. Also, another thing that this pressure point of pericardium 6 or Neiguan does is it helps stop the nausea, not only for new moms. Now, the interesting thing about this point is that if you say somehow you took too much CBD, or say somehow you were poisoned, if you press this point, it will make you vomit. It will make you expel the pathogen. If you do not have food poisoning, or you have not been poisoned, or you did not overdose on CBD, it will settle your stomach down. So if for some reason you just had an upset stomach, but it's not going to improve the condition by vomiting, this will settle your nausea or your hiccups or any type of what we call rebellious chi. So this will stop the nausea. It doesn't work as well as a pressure point, but it works, and it works fast. Another function of this point is that it helps It can actually, as I mentioned, stop and suppress chest pain and stomach pain. Isn't it funny how our gut is connected to our heart? And it absolutely is, and this channel proves it. So in acupuncture and oriental medicine, there's so much science around exactly that channel, how the heart and the gut are connected through the pericardium channel and can actually very effectively treat these type of pathologies. But this point, PC6, Nagual, pericardium channel 6, otherwise known in English as the inner pass, will help stop the hiccups, stop the nausea, help lessen any chest pain or stomach pain. And if you are supposed to throw up, you will. And if you're not supposed to, it will settle your stomach down so that you're less nauseous or not nauseous at all. And like I said, it works fast. We also do include this point when we have seizure patients, or if you yourself have seizures or twitches, things like that. Even though it might not be a full-blown grand mal seizure, this pressure point can still help improve the condition, as well as wake somebody up if they are losing consciousness. Okay, so today's topic in TCM Tidbits was a pressure point that I just taught you guys, known as PC6, pericardium 6, Nagual, or the inner pass. And it is, again, 2 inches below the wrist, in between the 2 tendons, which you can easily feel, and you just hold it there with your fingernail or press. You do it on one side, both sides, and it works fast. So give it a try. And if you like these wellness tips, please feel free to like and subscribe to our channel, where we will keep these wellness tips coming your way. Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, where today's topic was PC6, pericardium 6, Nagual, inner pass en anglais. And thanks for joining us today. Welcome to our channel of wellness, health and wellness, and quality of life. We're TCM Tidbits. Make it a great day, and Jusqu'à demain.